YNA is a podcast that focuses on mental health and other aspects relating to what goes on inside of a person's head. We are by no means professionals in this field and only aim to make these conversations about mental health easier for the listener. Nothing we say or talk about is professional advice unless explicitly mentioned. If you seek professional advice or experience symptoms of an actual mental disorder, please contact a professional or visit your closest center for behavioral health. You are not alone.
What's up, guys? Thanks for listening to today's episode. If you're looking for more of our content and merch information, be sure to check us out at ynamentalhealth.org. Keep an eye out for our skits and upcoming episode information. Feel free to reach out to us on IG. Our DMs are always open. And please remember, you're not alone.
Hello. Welcome back to YNA Mental Health. My name is Sina, and I am joined here with
Korolczuk.
And now, Lon, I know that you've had a lot of experience in the mental health field. Could you give us a little bit of background on what you do and what your certifications are?
Sure. Well, first of all, I want to thank you for having me. It's really an honor to be here with you today and to speak and share some of my, experience. I am a licensed professional counselor. I've been in private practice, transformation counseling for almost 5 years now. Prior to this, I've done some work at hospital setting, inpatient, partial hospitalization, and also intensive outpatient. But so far, private practice has been my thing.
With private practice, how different would you say it is from the whole hospital field? Is it like a night and day kind of difference, or is it pretty similar in different aspects?
I would say it's very different. With hospital setting, it just feels like a revolving door for me. Patients come in, you stabilize them, lots of paperwork, and then you get them out. And obviously, you don't get to fully experience the recovery, seeing the progress that patients make. Whereas with private practice, there's a more long-term process there, and you work with them more intimately in a sense where you do get to experience the progress that clients make, and it's very rewarding. You go on this journey with them, and it's pretty amazing.
It's totally great to see when a client walks in with how difficult things are going inside their head and then coming out after a couple weeks later on just kind of getting like a better self-understanding on who they are and what they're dealing with. Do you really see clients kind of change when they kind of walk out of here? And does the change truly give you a lot of faith in the mental health field at the current moment?
Oh, for sure. But this is also to say that it's not an up and down journey. Like sometimes they make progress and then they might have a little bit slip, and then you work through that and you continue to help them see the hopes and the progress that they make, that regardless of the fall back, it's still progress moving forward. And for them to recognize that is really helpful.
It's amazing to see, too, because you work with a lot of clients, so you see so many different stories, so many different backgrounds, cultures, diversity, and to see what works and what doesn't must be a really fascinating feeling. And so this episode, for the listener, this episode's on borderline personality disorder. And so we're kind of just going to hop right into it. Could you give me like a brief description on what borderline is and how it differs from the other personality disorders?
Sure. So borderline personality disorder, I'll just call it short BPD. It's pretty much a condition where the person struggle with a pattern of instability in their behaviors, their moods, their self-image, and interpersonal relationships. What makes this personality disorder different than others is just there's a intense self-destructiveness, impulsivity, where they also struggle with controlling their anger, their emotions, and also this fear of abandonment or rejection. And usually with that, they tend to have this distorted thinking where they're either good or bad, mostly just bad or evil, or this sense of like unworthiness, which makes it very different than others.
It sounds like it's a lot of like emotions, and I already know that a lot of people in our world have difficulty handling their emotions. Could you kind of give me the symptoms of what BPD has so that somebody can understand whether they have it or not?
Yeah. So some of the common symptoms, as mentioned earlier, that they do put in this intense effort to try to avoid any real or even imagined abandonment or rejection.
Mhm.
There's impulsivity where they engage in self-damaging behaviors such as reckless driving, binge eating, spending, unsafe sex. They have the struggle with a sense of self, of identity, and intense anger, where they
Mhm.
struggle to control their emotions. They do engage in self harm. They struggle with suicidal ideations or suicidal behaviors. There's mood swings, and typically these mood swings can last from a couple hours to at most only a few days.
Mhm.
And they can go from having like intense feelings of anger or depression or even anxiety, but like I said, the emotional swings, the mood swings of it doesn't last very long.
So with emotions, expressing them comes a very important part because of course we don't want to express our emotions in the wrong way. And as someone with BPD, I feel like you can express your emotions in a wrong way and people don't really understand that.
Mhm.
When it comes to expressing these emotions, what is it like? Is it going to affect your personal daily life when you're feeling these emotions? Is it like an explosion from the inside coming out, or is it
Mhm.
more of like I would say like a slow punch in the face, if you
Mhm.
want to kind of express how these emotions come out? How would you express them?
Well, I mean, try to imagine on a scale of 0 to 10, right? And with clients that struggle with this, try to imagine going from a 0 to a 10 so quickly like that.
Hmm.
The emotions, they express it so inappropriately, like, something that you can feel anger intensely, but then they act out on it at a 10, or if they're feeling so sad or so hurt, they can immediately go to something where they just want to maybe self-harm or I just want to die already. So yeah, like I said, try to imagine going from like a 0 to a 10 so quickly because they struggle with regulating their own emotions. They don't
Hmm.
have the skills. They don't have, the ability to do that. Possibly, with childhood, family experience where they weren't taught that, they didn't have the safe space to learn how to regulate their own emotions, and that can lead to that. On the receiving end, there's usually a common statement of like feeling like you're walking on eggshells with them
Okay.
because you just don't know what you're gonna get when you walk in the room with them that day. Are they like in a good mood today, or are they in like an angry, upset, frustrating mood today?
So you said that it can stem from family. And of course, it seems like a lot of these disorders that we deal with can stem
Mhm.
from our environment and coming back from our childhood and things that kind of traumatized us and kind of evolved into what they are. What would be like some childhood environments that could cause BPT? Like you said, regulating emotions or not being correct in the way to regulate emotions.
Mhm.
As a child trying to grow up, what would be like something that they could have gone through that would have them have this difficulty now?
I mean, I've read research, and the Frontiers in Psychiatry published an article not too long ago, maybe 2 years ago, where they went back and reviewed like studies of like 20 years. And there is a tie that is relating to BPD where there's childhood traumas, there's neglect of sexual, physical, psychological abuse, bully victimization. When you talk about family dynamics, for my own personal experience working with clients, there's usually a history of abandonment from a parental figure,
Hmm.
or neglect. Parents can maybe be there, but if the emotional neglect is there, they can also experience that as well. Not getting their needs met, their emotional needs, which then makes it hard for them to learn how to regulate their own emotions. If you're so focused on meeting your parents' needs, whatever they want, whatever they need, they decide and dictate for you, that which then leaves you no room for making your own decisions.
Hmm.
Or if you're feeling a certain way and then it gets dismissed or invalidated, that can also impact you, because then you're like, maybe my feelings are not valid. Maybe I'm
Yeah.
not worthy enough, or I'm not good enough for you to pay attention to me or to validate my feelings.
Hmm.
Which one of the things that, clients that struggle with BPD are where they do have that identity crisis where
Hmm.
they feel like, I don't know who I am, right? Um, if decisions have been made or dictated or controlled, then they don't know who they want to be because they're too focused on being whatever they can to please the other person.
Right. And they don't have that parental figure to look up to. So,
Correct.
like you said, BPD comes with a lot of issues with self-identity. And
Mm-hmm.
so when they don't have that mom, that dad, that
Mm-hmm.
person that they could be like, hey, I'm dealing with these emotions.
Right.
And they don't have the role model either. So it
Right.
doesn't help them learn how to regulate their emotions, right?
Mm-hmm.
I feel like if you can't, as human beings, we try to take other things from other people to kind of help ourselves. So, like, you try to look up to people and gives you the motivation to do more. But if there is no motivation around you and there's no identity around you, you kind of start, I guess, questioning what is identity.
From some of my personal experience working with clients, usually there's like a history of disruption in their education or career where they might end up switching majors a lot, or switching, dropping classes. Even like before they graduate, they might end up just dropping because they change a lot, or just change different jobs or different goals. Yeah, there's usually a lot of breaks through that.
You actually answered our question of how does borderline personality disorder affect one's self-identity. Clearly,
Yeah.
it can show in like your career, and could it also show in your friendships and relationships that you've continuously jump from friend to friend, or maybe your friends interact with you differently because, like you said, you don't know if your person's going to be mad. And
Hmm.
I don't think anybody wants to be, I don't want to be rude or anything, be friends with someone when you don't know how they're going to react, or how, if they're going
Hmm.
to be happy and sad or mad, or how angry they're going to be. Because if they can't express their emotions correctly, they're never going to be able to have this conversation with you like a normal person, right?
For sure, there is usually a disruption in close relationships, close friendships. So they do have a history of all. So inconsistent
Hmm.
in relationship. Sometimes they might, because they feel so insecure,
Hmm.
that sometimes they might end up ending a relationship before anything really happened, or end relationship even though there's a chance that this relationship could actually last.
Right.
Or in friendships, the same way, not being able to work through conflicts.
Hmm.
Um, so sometimes they get so angry that they end up, it's just either you're here for me, you're good for me, or you're not, and then they just cut it off. So they tend to have sometimes like that black and white thinking, because it's
Hmm.
very distorted in their own like faulty belief towards themselves.
Now, if you're in the position as somebody who knows somebody who's a borderline or who has BPD,
Hmm.
how do you communicate with them to make sure that they understand that their emotions are valid? I know one of the most important things is first understanding whether you have it or not, right? And then kind of
Hmm.
expressing to your friends and family if this is something that's uh, showing conflict in your daily life. If I was a friend and I knew a friend that had BPD, how do I talk to them to make sure that they are going to be able to express their emotions correctly to me?
Usually with this, I highly encourage like practicing healthy boundaries,
Hmm.
right? Obviously, when someone's upset, it's valid to be angry, but it's not okay to be mean.
Right.
And a lot of time when they're angry, there's that aggressiveness that comes out, which is being really mean.
Hmm.
And so times like that is where we need to practice healthy boundaries with them, and even learning not to engage when they're angry, and coming back to address conflicts, coming back to when they are feeling safe, when they are calm, to talk about conflicts, to talk about, whatever's that they're struggling with.
Hmm.
And it helps to, validate. It helps to validate so that they feel heard. so that they know their feelings are valid. But at the same time, we want to address behaviors and that it's not okay to be mean.
Yeah.
Yeah, because like I said, a lot of time we end up feeling like we're walking on eggshells with them. So then we don't want to upset them. So then we don't talk about what happened. And
Right.
sometimes, a lot of times, like either friends or family just either avoid them, and then conflicts doesn't get resolved. We don't
Yeah.
understand what happened, or they end up just giving in to the person. So then, because we're giving in, now we're enabling that kind of behavior to continue.
Right.
Yeah.
So I think one of the scariest things is when you do get diagnosed, if your therapist does inform you, or your psychologist or your psychiatrist who informs you that you do have BPD, how do you handle this diagnosis? Do you have anything that clients have personally told you after being told that they have this disorder and how they handle it, just to make sure that if I'm somebody who I have, like, if I'm been told that I have a disorder, usually we go into self-diagnosis mode, which is just first treat, like, what can I do? What is wrong with me? And you go down a spiral of overthinking of like, why me? Is there anything that you could comfort them or tell them that, like, of course, this is completely normal, but
I mean, I do try to normalize their feelings, but typically I would go into like psychoeducation and kind of understanding like the stigma that comes with mental health in general, let alone having a borderline personality disorder. But I try to comfort my clients and reminding them that, you know, if we have medical issues, how come it's okay to go and seek help with a medical doctor? But then when it comes to mental health, or such as having a diagnosis of BPD, that it becomes like this big deal. Like, it doesn't need to be that way. Like,
right.
we're human, and it's important to also remind them that we're human, we're not perfect, and that we all struggle with something. And it's important to get the help and not have to struggle alone in this.
It's just a reminder out there, you're not alone. Part of the name of the podcast, just reminding people that, like, what you deal with and this mental health stigma that we're trying to, of course, break, and remind people that it's okay. If you are diagnosed with this disorder, it doesn't mean you're some sort of monster. It doesn't mean you're some sort of outcast or a black sheep. That it's
Right.
completely normal that these people, you go through these, but it's better to understand what you have now and kind of figure out how to live your life with it, than rather go into this spiral of like, oh my God, my life is going in a complete different way now, and what am I going to do with myself and things like that. It's just understand who you are. And I think it's going to be hard, right? Because BPD has an issue with self-identity. And so these things can cause issues later on. But again, of course, reach out to your professional, see the people that you would need to help.
For sure. I would always say, please ask questions and have these discussions with, your therapist, your doctor, even with your friends. If you're concerned and you're unsure, open up this dialogue to talk about it and normalize it, instead of having this like taboo, let's not talk about it.
Right. Can a person fully recover from BPD, and what is the outlook for individuals with BPD who receive treatment and engage in ongoing therapy?
Yes, you can. It is a long process. And according to research, over 80% do recover and no longer meet the full criteria. But it is a long process, it's a journey. So, if you participate in treatment and you do the work, yes, it's possible. But it's a long process. Yes.
And I definitely could see why it's a long process, right? Because I feel like with any disorder, anything at all that you have to deal with, it's a journey that's in front of you that you're going to have to take. And it's truly up to you, right? Like, if you want to go receive the help, if you want to see yourself get better, it is up to you to kind of push that movement. And I know that one of the theories, dialectical behavioral therapy, is used to help BPD. Do you know what specifically it does to help BPD? Is it like kind of like just the switch in mindset, or what could it be?
Well, the DBT helped them to kind of deal with the distress tolerance, because they don't have that.
Yeah.
It teaches them skills such as mindfulness, how to regulate their emotions, because they struggle with the uncertainty of of things in life, having the skills to learn how to tolerate uncertainty comes up.
Hmm.
Me personally, I'd like to combine that with some of my own other trainings, such as like internal family system, where I do try to tap into understanding their different parts where they struggle with, like, the part that fears the abandonment, the wound, the part that gets so angry but
Hmm.
then like lashes out or acting out. So I try to combine different modality to help when I work with clients. So
And when it comes to these other theories, of course, every therapist has their own theories, their own methods of figuring out what is the best treatment. And everybody's treatment plan is completely different because, of
mhm.
course, other disorders do mix in. And you might work with somebody who uses DBT, but it might not be for you. And so, always asking your therapist about what kind of methods they're going to use and kind of getting an understanding of what your treatment is always important too. So, always look into that and kind of get an understanding of what you're going to learn and what's going to help you. But I know that self care plays a very important part, right? Like once I walk out of this room, it is up to me to practice becoming a better, not a better person, but becoming better with my disorder. How does someone with BPD practice self care?
And self-care is going to vary from person to person. Everyone
Hmm.
has their own thing that they do to help themselves, right? And if we're struggling with expressing our emotions, we can go to journaling,
Hmm.
write down your thoughts, your feelings. You can either journal about it or you can write it down on a piece of paper and rip it up. I've had clients that actually enjoy doing this. They get so angry that they write things up. I always tell them, like, no filter, write everything down, swear, curse, whatever it is you need to do, then rip it up or burn it. I've had clients that have done it and then they feel so much better afterwards. Blankets, wrap yourself in a blanket because
Hmm.
that's that comfort,
Yeah.
right? And watch a movie, watch your favorite TV shows. A lot of time they get this, again, when they're high stress, some of them even might develop like psychotic symptoms, like, or even hallucinations. And so with high stress, it's really important that they learn stress management skills
Hmm.
and giving yourself that break. Because again, when they fall back into that I'm bad or I'm no good, I'm worthy, they might do work, 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 and just ruminate on things and not have that healthy coping distractions, help the healthy coping mechanism to
Right.
help them calm down from that. Cuddle with your pets. If you have a pet, play with your pet. Take some time for yourself.
And what you said, I never looked at it like that, like putting a blanket on. And I've known that, like, I've heard that, like, weighted blankets actually
Hmm.
help somebody feel like it kind of pulls their depression or anxiety away from them and it helps them kind of relax. So I know that's definitely one of the good treatments, and I will definitely use for myself as well. I never thought about that. That's a really good one. I've also done journaling before. It does really help. It's truly wild to see when you write down these thoughts how much of a different mindset you are once the thoughts are on paper.
Hmm.
It's truly incredible to see the kind of journey you can go through with just a couple days of journaling and just doing the right things to kind of help you. I know that medication, of course, plays a big part in helping treatment. Is there medication that can help people with BPD?
I mean, not specifically, but
Hmm.
I do know that some doctors do prescribe medications. So let's say if they struggle with depression, because sometimes they do experience that. So there might be antidepressant that gets prescribed. There might be mood stabilizer that gets prescribed. And like I mentioned earlier, sometimes when they're extreme high stress to the point where they might experience a little bit psychotic like symptoms or even hallucinations, then
Hmm.
sometimes a little bit medication might also get prescribed for that too. It all depends on case and severity and how doctors want to approach that.
Right. And it's talking to your doctor and, like you said, asking the questions, putting yourself out there. It's totally okay. Just even starting with small questions and then going deeper, it's totally understandable. Start slow and just understand what you're going through rather than going into the full, I need medication, this is going to help me kind of process. Because I've seen that with a lot of people. that they think that medication is the answer when sometimes it may not be your answer.
No.
It could be therapy. It could be both therapy and medication. It
Correct.
truly is scenario basis. I think one thing that I'm trying to understand are, I know there's stereotypes that come with different disorders. Are there any myths or stereotypes that you would want to crush now on BPD?
I mean, there's obviously a few.
Mm-hmm.
Let's see, the first one that comes to mind where there's this perception that there's more with women than with men.
Mm-hmm.
So I think the past research was trying to say that there's a ratio of like 3 to 1, like female to male, but that's not true. The reality is that there's more women seeking help.
Mm-hmm.
So if there's more women seeking help, then you're going to see that you get diagnosed more than men.
Right.
But in reality, the rates are comparable.
Mm-hmm.
And then on top of that, men and women do exhibit different symptoms. And so sometimes that might get misdiagnosed as well. Because like I said, for women, the impulsivity might come in with like the binge eating,
Mm-hmm.
or whereas with men might be more like on the reckless driving or spending or anger lashing out, where with the women, they tend to internalize it a little bit more. So then they might do more self-harming, cutting. So it varies, but that's not true to say that women are more, diagnosed more with BPD than with men. So that's not true. There's like another one where people that struggle with BPD are attention-seeking manipulators,
Mm-hmm.
and that's not true. It's actually very complicated. And when I work with clients, for me, I tend to focus more on their childhood traumas and try to understand their family dynamics. And with traumas, there are so many different layers, and they struggle with that. And so I prefer to dive into that. And usually, if you're a therapist and we get triggered when we work with clients, that's usually a reflection on us to see, to work on yourself, the part of you that's getting triggered by that. And it's like, wonder why, instead
Mm-hmm.
of putting it on, the clients. It's complicated. They do struggle, and they're not always coming in trying to manipulate us because they don't know how to ask for what they need and want.
Right.
So they do struggle with communication. They do struggle with healthy boundaries. And so it's our job to demonstrate that and teach them that.
Mm-hmm.
Yeah.
I know a lot of people mention healthy boundaries, but what does a healthy boundary really look like? Could you express anyway, like what it kind of
Sure.
seems
I
like?
mean, boundaries are kind of like your own lights. I try to picture it. I'm a visual person. So try to imagine red light, yellow light, green light, right? So your boundaries are there to protect you. And it tells you what's okay, what's not okay, what's comfortable, what's not comfortable for you, not about others. It's for you.
Mm-hmm.
So if we're engaging in someone and they're getting angry or aggressive, that's not comfortable for you. That means we put a stop to it.
Mm-hmm.
And we communicate. I'm getting uncomfortable right now. I need you to lower your voice, or, X, Y, and Z. If not, we're not going to have this conversation.
Right.
Because if you're uncomfortable and you're forcing yourself to sit through something that's uncomfortable, and you're heightened alert, and where our fight or flight is about to kick in, right?
Yeah.
Or sometimes we freeze or we fawn and we become that people pleaser with them,
Mm-hmm.
and we give in, and that's not okay.
Right.
Whereas if we're uncomfortable right now, learn to put a stop to it.
Mm-hmm.
And if the person doesn't, lower their tone or change their behavior, then we remove ourselves from the environment. That would be one way of practicing healthy boundaries.
And that's awesome. That just kind of opened my mind, because I know that I always hear the word boundaries, 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 but I sometimes don't understand how to like set my own boundaries, or how to what is an example of a healthy boundary. So I know that example was perfect and can really help people. And as a friend who might have someone who has BPD, and I'm trying to set these healthy boundaries, how do I get them to of course, you can't push someone to go get the help that they need, but how do I help them get the help that they need? Is there anything that you've heard from clients that, hey, my friend recommended me to go, or hey, my friend helped me, or my family or somebody kind of pushed me into this direction? Because sometimes we do need that little shove or that little nudge to kind of get us going.
I mean, you can only do what's on your end, which is expressing your concerns to your friend or to your family members, right? You can only speak for you. Hey, I notice. Hey, I'm concerned. You can only speak for you. What they choose to do with that information is actually up to them.
Right.
And if they don't do anything about it, the only thing that you can also do on your end is, again, is setting that boundaries with them. But also practicing self-care, stress management on your end as well, because like I said, sometimes their behaviors can be very difficult for us.
No, and I totally understand. And now we're coming to the end of the podcast. I think my last question is, what advice and life tips in general, doesn't have to be about BPD, would you give someone who is struggling with their mental health at the current moment?
When we're in that dark spot in our life, it's so hard to try to see the light out of that. And we feel so alone and isolated. And I forgot to mention, that's another thing with BPD, is that they do feel this ongoing emptiness and loneliness. But in general, with mental health, when we are in that dark spot, it is really hard to kind of see the light out of that. But know that there is a light out of that. And you are not alone. Lots of people struggle. No one's perfect.
Right.
No one's life is perfect. No one's family is perfect. We all struggle with something at some point in our lives. And so knowing that there are resources out there, it takes a lot of courage to reach out for help. It is not a weakness. It is actually courage. Being vulnerable in that moment, in that time, and to know that I can reach out for help and do something about this. It's a big deal. So
I think the word for this episode would be courageous, because to gain the courage to come to get the help that you need, to have this self-awareness, this self-identity, to be like, hey, I need to get this under control, or I need to figure out what's going on. It's truly courageous. It's not a weakness, like Lon was saying. It's truly something that comes down to you and understanding who you are. So please never forget that you are not alone in what you're dealing with, and that we will always be here to provide the information. And if you have any questions, feel free to give them to me, and I will reach out to Lon and see if I can get an answer, and we can figure things out. But understand that you are not alone, and you will get through this, and we will catch you on the next episode. Thanks again for coming onto the podcast, Lon.
thank you for having me.
Anytime.